Hello, Suzanne Connor-Sick with Dawning Visions Hypnosis, here to speak about a situation which comes up from time to time on Quora, where therapists complain about the fact that they never really received good training in the sense of supervision from their supervisors. This is a real problem on a few different levels, actually. First of all, if you are in a situation where you are unsure how to move forward with a particular patient, your supervisor needs to be there to help guide you in how best to handle the situation. If you have a patient who has an outburst or harms you emotionally or even physically in some way, your supervisor needs to be able to step in to help you to better deal with a situation like those going forward and take some action on your behalf regarding that particular patient. There are also issues where supervisors are not really that healthy themselves, so they don't really know how to guide you in how to best take care of your patients, and that's an even larger problem because you wonder how in the hell they got in that position in the first place. It's anyone's guess. Supervision is really, really important because it takes time to truly learn how to work with all the various types of mental health patients that you're going to come across in your practice. And even if you specialize, which is really a very good idea to do if you actually want to be able to increase your income, being a specialist will always pay you more, it's helpful to have the correct guidance as you're learning the processes that you need to learn to best help these patients to move forward in their lives, the reason why you're employed to work with them in the first place. I've had supervisors in the past who were demeaning to my clients. They were demeaning to me. They had outrageously unrealistic expectations of the clients in our programs. One in particular was a schizophrenic who my misguided director of program thought could actually clean his own room on his own without me being there, which was totally untrue. This guy was so scattered all over the place because of his schizophrenia. If he didn't need to be in the program, he wouldn't have been there in the first place. Just ridiculous expectations. I had another director of another supported housing program who was really demeaning and nasty toward one of the clients who had once been a registered nurse who got into drugs and fried her brain basically, was incapable of nursing anymore and had some really bad mental health issues as a result of it. She was the sweetest person on the planet, and yet she had to deal with this garbage. And this same director gave another one of my clients a note when he asked to have his psychologist come in and talk to the counselors, most of whom were in their early to mid-20s and knew nothing about life, never mind about how to help people with mental health issues who are double their age, to better help them work with him because he had feelings of paranoia towards some of them because of the things they said and the things that they did in the program. I thought it was a brilliant suggestion from the client, and I have found over the years that our clients do have brilliant suggestions if we'd only listen to them and do as they require and request. It's not that hard to do. We have to get our egos the hell out of the way. So we need to really think about the type of clients that we're working with and why we choose to work with those clients and whether or not those clients have the wherewithal to do what it takes to truly heal, along with income to be able to pay you what your transformative work is actually worth. But here's where the problem really truly lies when it comes to conventional mental health. As far as I'm concerned, having been working in these programs of conventional mental health and then going on my own, learning hypnotism and neurolinguistic programming, is that you never really learn how to help people heal. Yeah, you can sit there and say, well, the sessions help them, we help them to learn cognitive behavioral therapy and we're able to do different kinds of therapies to help them to manage their symptoms better. And we're able to give them drugs, to take away some of the symptoms. But this is not healing people. These are mere Band-Aids. And I know because I was once a patient with bipolar 2, manic depression, when I was diagnosed back in 1989. And though the medication certainly did help me act more sanely, it did not take care of the underlying problem, which had to do with the limiting belief, which once gotten rid of, along with some negative emotions, it went away. Poof. And my ex-psychiatrist did follow me for 10 months once I was off the minimum amount of medications I was on at that time. Having been on the medication for over a decade, it started toxifying my kidneys. We did creatinine level, the urine, which demonstrated that. I was pulled off the medication, and thank God, Tad James, my NLP trainer, was able to help me to get rid of it once and for all. That was back in 2004, February. It is now April 9th, Easter Sunday, as I'm recording this, 2023. That's a really long time to prove that this work works. So I invite you to think more about how you want to structure the way that you do the work that you do, and invite in patients that are interested in truly healing, where you can provide so much value to them to transform their lives quickly and effectively that they'll love to pay you pretty much anything you ask for. Because those with disposable income, their time is the most valuable asset they have. I can tell you this working with CEOs who spend 6 to 8 weeks on the road doing their jobs in the multinational corporations, far, far away from their families. Their time is really valuable. If you'd like to learn about my 2-day VIP online one-on-one program, I only allow 1 new trainee a week because I can only mentor so many people at a given time, because it does include a 12-month mentorship as well. I will drop my contact information in the description below so you can ask me questions if you're interested in that program, and I'll let you know when I am available to do that with you. I have had trainees who have left the medical world, sick of dealing with health insurance, and as one of my clients put it, the shackles that are put upon you by the associations and all the rules and regulations you have to follow. And I had another one who is doing some really excellent work, who is an NLP practitioner who really didn't learn how to do this stuff correctly, so he couldn't really emulate the, shall we say, objectives that his trainer said he was supposed to. And he's doing really great right now. And I had another one who left the medical world totally because she didn't want to have anything more to do with it. And she was a PhD psychologist. She just, I don't know if she sold her practice or what she did, but she got rid of her practice and is now just a coach, earning a lot more money doing coaching with her ideal clients and having a really good time and doing really excellent work. So that could be you if you're open-minded enough to actually want to learn how to do these things in a really fun manner, and to learn how the subconscious, unconscious mind truly works to transform anyone's mind, including your own, because you will be doing your own therapy to learn how to do this stuff, to learn the techniques. That's all I have for you for today. Thank you as always for taking your time to be with me. Until next time, bye-bye all.